What if Ozempic could actually limit the ability of cancer to spread throughout the body? This weekend at the biggest cancer conference of the year, Cleveland Clinic researchers are going to show that GLP-1 drugs might limit the ability of cancer to metastasize by up to 50%. And as a neurosurgeon that takes care of patients with brain metastasis every week, this is important on two levels. One, it's a potential new tool, and two, it might completely rewrite how we think about how cancer, inflammation, and the immune system all work together. But first, let's take a look at the study design. They looked back at a huge database of 12,000 patients. These were patients with cancer that were started on a GLP-1 drug after their diagnosis. The other half of patients, the ones that they were paired with, were ones that were started on a drug called a DPP-4 inhibitor. No randomization at all. They were matched for baseline things like age, weight, and other characteristics. So this was a retrospective, not prospective trial. Now let's take a look at the numbers. Lung cancer spread rates dropped from 22 down to 10%. Also impressive were breast cancer rates that dropped from 20% spread all the way down to 10%. Overall, 4 of the 7 cancers that they looked at showed statistically significant decrease in spread. But here's what you need to know other than just reading the headline in the press release. 1, the comparison diabetes drug, it also works on the GLP-1 pathway. It's just weaker. So it's strong activation versus weak activation. 2, GLP-1 drugs are known to cause major weight loss. The competitor, not so much so. So we can't tell if it's a benefit of the drug itself or the weight loss. 3, it's a poster, not an oral presentation. Interesting enough for the scientific committee and for me to share on here, but we're still pretty low on the evidence ladder. This doesn't change clinical practice at all, but I do think it will spark a clinical trial. And there's a very interesting nugget that's buried in the abstract itself. Patients with tumors that express more of the GLP-1 receptor, they had better survival. That hints that the receptor is actually in the fight and it's not just the weight loss itself. But we still don't know exactly why this observation might work. Is it reversing obesity's metabolic state, direct effects of the drug on cancer cells, lower insulin, or maybe something else? The signal looks real and the biology is plausible. But the headlines you see all week, they're going to need a healthy dose of restraint. When the first randomized trials read out, that's when we know what direction we're headed in. If you thought this was interesting, let me know in the comments and share with a friend. And make sure to follow along for more from the front lines of medicine right here from my treadmill.